There are only a handful out of the 100,000 doctors, Canadian doctors, that didn't take the vaccine that are still practicing medicine. So it's something like 99.9% vaccination rate. And they were the first ones to line up for their vaccines. Well, as I started looking at the sudden deaths of Canadian doctors, I realized, yes, most of them are dying from cardiac issues, heart injuries, cardiac arrests, dying while jogging or swimming, dying
Yeah.
in their sleep. And Dr. Peter McCullough has talked about this extensively about the myocarditis and the damage to the heart, the scarring to the heart. And then some were dying from blood clots, pulmonary emboli, strokes. But then there was quite a large subset of doctors who were developing extremely aggressive cancers and cancers at an age that they shouldn't be getting. So, for example, there was a doctor who developed gastric cancer in his 30s, presented at stage 4, he was dead in less than a year. Very rare brain cancers in young individuals in their 20s and 30s, medical students, medical residents. And these cancers would always present at stage 4, and they would always kill them in a matter of a few months, and it was always less than a year. And, at first I didn't know, what the term for this was or what the phenomenon was. I just started, really paying attention to it, tracking it. I then, realized that this is being called turbo cancer by people on social media. Turbo cancer is not a medical term, but it's a term that people came up with to really describe the extremely aggressive nature of these cancers in the COVID vaccinated. And these cancers behave completely differently, unlike anything I've seen before in my career. And I've diagnosed over 20,000 cancer patients in my career with cutting-edge PET-CT, positron emission tomography imaging, CT, MRI, pathological correlation. I've never seen anything like this. I've never seen stage 4 breast cancers presenting in women in their 20s. I've never seen stage 4 colon cancers presenting in men and women in their 20s, 30s. Leukemias that will kill you in a matter of days or even hours after diagnosis. Lymphomas that, again, kill you in a matter of months.